안녕하세요. 저는 JF 피부과 김상엽 원장입니다. 한국에서 피부과를 전공하고 피부과 의료 미용을 하고 있는 피부과 병원을 운영 중에 있습니다. 오늘은 튀르키예에서 오신 의사 선생님들을 모시고요. 우리가 많이 사용하고 있는 PDLLA 제품을 어떻게 사용을 해야 조금 더 안전하게 사용할 수 있을까에 대한 주제로 도로시와 PDLLA를 믹스해서 사용하는 방법에 대해서 주로 강의를 할 거고요. 이 강의 주제에서는 총 3가지 케이스의 환자분들을 라이브 데몬스트레이션을 할 겁니다. 한 가지는 니들 인젝터를 이용한 도로시와 주베룩 PDLLA의 주입법, 그리고 니들을 이용한 레니스나와 도로시를 섞어서 주입하는 방법, 그리고 마지막으로는 히아필리아를 이용해서 미드 페이스와 로어 페이스의 볼륨 오그멘테이션, 볼륨 리스토레이션에 대해서 보여드리도록 할 예정입니다. You can see this is a 33 gauge of the. This is quite. This is long. The Dorothy can pass through. Can you see that? 35 gauge with the 2 millimeters. As you can see, very short. It also can be injected. Then I prepare the Juvelook with the 5 millimeters of the normal saline and 1.5 cc of the lidocaine. So total 6.5 now in here. So I mix it the 2 millimeters of the Dorothy in here. So total 2 cc of the Dorothy were in here. Then with the 3-way, I mix it in like that. And with the 5 cc of the Juvelook syringe, and then I put the 5 more 5. And I will show this the machine. And there's 2 types of the machine. One has some 9 pin. Total pin name is 9 for the 5. 1, 2, 3, 4, 5. And this one is also 9, but the velvet size different. This velvet size 1.4 millimeters. For the Juvelook and Lenisna, superficially inject. As I mix it with the Dorothy, it's a cross-linked HA. Gonna be also make some immediately embossing. So that's why I'm using the 1.4 millimeters velvet. And this is a suction tube, connected with the suction tube like that. So the velvet size is 1.4, so the ideally more than a 1.4. So I'm setting the 1.6 or 1.8. So in case I pointed to the 1.8. I will do the procedures. 괜찮으세요? Because it has some suction in here. Yeah. The wet suction is loosened. Then we move to the another step. So you can see compared to the other competitors, it does not too much liquid of the Juvelook and Dorothy. So if the volume was too slowly injected, you can change the setting.
Is normal?
Bleeding? Yeah, it's normal because we push it in the 1.8 millimeters.
You change patient to patient?
Yeah, right. You have to change the tip patient by patient. So the 1.8 millimeters it can be injected all this area because the skin thickness is more than the 2 milli, at least 2 millimeters. So you can treat it whole area. Once again, this have some RF generators in here. By pushing the solution by needling and simultaneously do the RF injections, can be theoretically much distributed the Juvelook and Dorothy. And then we change the tip. When you fastly move back to this top, just turn up the machine and turn back. They're gonna automatically move back to the frontward. So just put the saline gauze to the bleeding area. You can see all the bleeding stopped automatically, so don't worry about that. We can adjust the injection depth for example, when you're using the Rijuran or other, except not the HA or not the Juvelook, we can adjust from the much more superficially, like the 0. From the 0.5 to 6 or 7. But with the Juvelook, yeah, as you know, it has some particles in there, and it has some possibility of make some nodules. So my purpose to inject the Juvelook is not the papillary dermis, it's the reticular dermis. Even though the 1.8 millimeters, lots of bleeding was seen, but I just put the saline gauzes in there. So now you can see there's no bleeding or bruisings are seen. If you're using this injector with the Rijuran, it can be injected much more superficially. Yeah. 아픈데. 네, 됐어요. This case, as I mentioned before, I'm using the Juvelook volume needle point injection technique. The lady's forehead area is slightly sunken. You can see from the, as you know, we have to the lots of eyebrow movement. That's why this area sunken first. So I will cover it, then to holding up the soft tissues in there. She's very worried about and concerned about her face is not the dimensional way, looks like flat way. As you know, the Asian cheek area is much more weakened and flattened compared to the Caucasian. So in case, I will put this area first to make the apple cheek way. Yeah. So sometimes the Asians doesn't want their cheek to widen, but from the aging perspective, so you have to maintain this area. Then I put some volumes like that way. Then I put some pre-zygomatic space like that way first. She got some Juvelook volume in the nasolabial fold, so I skipped it. And how about the lower face? As the filler way, I put the Juvelook volume in the mandibular angle way. So as you know, the mandibular angles prolapsed. Her face is much more lifted way. Oh, there's temple hyaluronic also in here. You see? You see? I put the Juvelook volumes in here. She doesn't have any subzygomal hyaluronic, and and mid-cheek volumes quite abundant. This is the normal saline 5 millimeters and 1.5 cc of the lidocaine in here. Then I'm mixing with the in case 3 cc of the Dorothy Dewy because it kept some cross-linked HS in here, so it had much more power to stain more volume, immediate volume. Yeah, Lenisna made the volume, but instantly the Dorothy Dewy made the volumes. And mix it with it like that. Endless 10. Endless 10. And 0.2 cc by each side.
Yediyle yaptı. Hani 32'den geçiyor dedi.
Bize yaptı 32 ile ama 35 ile.
And after the injection, you can see these some nodules in there. Yeah, you have to. By the needle injection, you have to be molding like that. Then you might see this some hyaluronic in there. I also put the volume.
Hocam masaj
Touch the bone.
yapılmazsa peki düzelir mi zamanla?
When you're using the needle, you have to strong massage, okay? But the cannula, I'll show in the next case. I'll do another stretches. I think the eyebrow lifting have some good looking. Yep. When you do the needle, I always touch the bone. Yeah, I put some eyebrow area in here, 0.2. Then I move to the temple area. Temple also touch the bone. Then I put the main zygomatic ligament to make the upper cheek much more popped. Touch the bone. .4 cc. You can see there's some more elevated in there. Then I put the pre-zygomatic spaces in there. Probably. Touch the bone. And there's some angular artery or angular vein or facial vein goes through in there. Slowly injected 0.1 in here. And there's some third. There's no sign of the aspiration. You can see the differences about the patients, the forehead to the temporal line and the mid-face line. Then if the patient really want to much more the shortening of the mid-face, so now in Korea trends to the mid-face much more shortened, then I put more volumes in DMCF area. In case, I put in here, there's a DMCF in here, put deeply, and always do the mid-face rigors first. Then I put the 0.4 cc volumes also in there. When you're dealing with this needle technique, always care about the vascular using the cannula, but with the needle also can be shown this good result. And lastly, I go to the mandible area. As you know, there's some big vein runs through in here, so you have to watch out not to make the vascular accident. Rigors first. You have to see. There's a no. You have to see. Now you can see this area is slightly elevated compared to the left side. Okay, I can see that's it. So there's two types of mandibular angle augmentation. If the man who really wants to the wide and angle, then I push it in the lateral, not the behind. But the women who doesn't want to the angles much more prominent, then I put the behind of the mandibular angle. Like you can see, there's some mandibular angles in here. Then I put the behind of the angle and touch the bone. Regards.
touch the bone.
Yeah, touch the bone. Always, when you do the riddle injection, always touch the bone. It's very safe. All right. You can see the angles much more sharpened. Let's check the patients. Which area does not decrease. Alright. Yep, that's it. As you can see, the forehead depression is gonna be healed, and the temporal area and the periocular area and the prezygomatic and the DM shape also be filled, and the muscle angles, mandibular angles must also be treated. So that's why I put some volumes in here to make some jawline much more sharpened. Okay, that's it. 네, 고생하셨어요. Any questions? So I made the opening frontotemporal crease. So in here, yeah, for in here. In here, when you're covering the layer 4, the defect area, subgallia space, then push the cannula tip and go through, and they're going to passing the innominated fascia, superficial layer of deep temporal fascia. So this is very quite good area to the volume treatment. And then with the 2 centimeters lower of the lateral canthus, made an opening in here, and 2 centimeters lower the lateral canthus to cover the oriental of the facial vein, the medial side, the medial DMCF, the lateral side, the lateral DMCF. And there's some prezygomatic space in here, so I put some volumes also in here. Also, chin area also be sunken or shortened, and this area also be shortened. So I made some opening in here because, as you know, infralabial artery runs between the DAO and DLI, and then they goes in the like that way. But in the midline, there's some quite avascular area runs in here, so I made an opening in here. I put the Juvelook for the rejuvenation of the whole area with this opening and another opening in here. Summing up, in case of the Juvelook rejuvenation, I made 3 openings. But in case I made it in the perioral area also, so I made 1 additional opening in here. So summing up, the 3 openings could be covered the whole face. The first one is the deep lateral compartment, and deep central compartment, and deep lateral compartment also in here. So the key point of the Juvelook lenicidine injection for the forehead. So because there's a mixing with the HA, we have to covering the whole these 3 area, and then I'll put the lateral DMCF in here, medial DMCF in here, and there's a inside of there's a facial vein running through like that, and prezygomatic space. And also I put the lateral sub area in here, and the chin area in here, and the perioral area in here, like this. 네, alright, let's go start. Disinfection first. For the point injection, 후시모은 마취 중이에요, 마취. 이렇게 to diminish the initial volumes, and touch the base, turn down. Yeah, it's layer 4. Yeah, subgallial space. I put the volume like that.
How many guys?
이거 몇 게이지냐? 23 gauge. So because I did not any some tumescent for the blood, so in this case, I put the anterograde technique first, anterograde, then rest of them to the retrograde. Touch the bone and go through. Put the volume anterograde to the retrograde like that. And the eyebrow, lateral eyebrow, 0.1. Normally, I left 1 cc of the Juvelenissna to massage. 손이에요, 좀 누르는 거.
When the patient stand up,
Oh, no, it doesn't matter. Maybe there's some adhesions showing in here. So there's some two ligaments. If I made the tunnel in the globular area, so they gonna be the swelling moves down. But usually, when you're not doing with the Juvelook, yeah, globular line, yeah. Who actually she's first time to get these procedures, filler procedures, so very nervous, but yeah. In here, lateral DM shaft with the 0.5 and move to the medial DM shaft. 압박감이 느껴지긴 하죠. 압박감이 느껴지는데 시간 지나면서 마취가 돼서 괜찮아질 거거든요. Then I put the 1 cc in the DM shaft, 0.3 cc in the main zygomatic ligaments, or somewhat. Then I move to the pre-zygomatic space, which also named the soup. And you can see it's very deep. So filling in the volumes in there. Retrograde. What? Alright, lateral DM shaft first with 0.5 cc and the medial DM shaft. Rest of the 1 cc.
Diğerleri de yapıyor hocam. Yani böyle bir yıl falan
이제 마지막 큰 산 남았는데
dudaktan
하면
dudak için
then I put more volumes in here. 0.2.
dudak
3 minutes done. Then I move to the lower face. 여기 마취가 제일 아파요. 자, 심호흡 준비하시고 V로. When you're feeling with this area, must have to subacute. 됐어? 네. One touch like that.
soğuk.
One touch. Yeah, I also do the needle injection for the chin augmentation, but in case I will have to put some volumes also in there. So to reduce the puncture site, I use this area for the augmentations. Alright. The lastly, using the S, so I injected the B, heart, and S to put some volumes in here. It's so cute. You can see the silhouette of the cannula like that. Then put the volumes in here. Retrograde, very small amount. Sometimes I also do the same treatment with the Lenisna, with the Dorothy. Yeah, but as I was showing before, the patient doesn't have any some depressions but when they smile, they live in some depression there, then I'm using the Lenisna. But in case the patient have some depressions, obvious depression in there, then I'm using the fillers. High filler is very smooth, so I put the 0.4. Also the same way I put the volumes like 0.4. That's it. In the subcutaneous layer. So yeah. And then lastly, I put the Juvelook for the rejuvenation in the layer 2. Now I put the Juvelook with the Dorothy in the subcutaneous layer 2. You can see the silhouette in there. It's so cute. And put the Juvelook push back 0.02. Yeah.
Üstüne cila gibi yapıyorsun. Şöyle model bakıp.
To rejuvenate the skin. So in case now I'm passing the nasal labial fold line like that, then fold line, then I covered very small amount. That's it, not too much. Okay, if you do the bolus injection with the needle, may have some other, as I mentioned in the granula, because the deposition of the sweat, yeah, in there. Now I move to the barcode line also, like that way. Yeah, barcode line also can be treated with the Juvelook, with the Dorothy. Because only with the Juvelook does not effect, because so many patients have some complaint about what you did, no change. But with the Dorothy, yeah.
Hissettiği için kanın o bölgede rahat döndürüyor.
In the nasal labial fold line. 턱 좀만 더 들어. 돌게 살짝 옆으로. 좋아요. 됐어요. Alright, the treatment is done. 다 끝났어요. 자, the forehead was treated with the Lenisna, and the mid-face, the DMCF was filled with the hyophilia, and the pre-zygomatic space is also filled. As you can see, the main zygomatic ligaments are filled with the fillers. The face is much more lifted. The first lady, she has lots of some eye bag prolapses, but I filled it in here, so our mid-face volumes are tenting up. So that's why you don't not see any prolapse of the eye bag. In this area, somewhat some swellings in there, but Juvelook also be filled within there. So want to put more volumes about the chin, but yeah, this is the first time to get the medical treatment. So I think that's it.